Well, of course, settling the junior doctors dispute would probably cost less money than all the cancellations and aggravation that's happened on the back of it. And of course, they have settled in Wales and they've settled in Scotland. During the Blair-Brown years, it had 6.1% per annum for a decade, and there's no surprise that by 2010, the service was performing very well. We got rid of long waits, patient and staff satisfaction were high. In the first 9 years of the Tory-led government, we went down to 1.1% per annum, which was the lowest real terms funding uplift in the history of the NHS. And the Health Foundation analysed us against 14 other EU nations, who were about 20% behind.
Welcome again to the Dartington Library, where one of our guests here for the Byline Festival is David Oliver. He is a consultant physician. He's a columnist for Byline Times and the BMJ Journal. And he's been debating a question I think that many people will have on their minds as we go into a new era of government, which is, does the NHS need more than money? Firstly, David, though, let's just establish what money can do for the NHS and whether it's likely to get the amount of money that it needs.
Okay, I'm glad you asked the question, Adrian, because money does matter. And over the lifetime of the NHS, it's had a 3.4% real terms annual uplift in funding. And every developed nation has to put more money every year to healthcare. During the Blair-Brown years, it had 6.1% per annum for a decade. And there's no surprise that by 2010, the service was performing very well. We got rid of long waits, patient and staff satisfaction were high. The service was working well. In the first 9 years of the Tory-led government, we went down to 1.1% per annum, which was the lowest real terms funding uplift in the history of the NHS. And the Health Foundation analysed us against 14 other EU nations, who were about 20% behind. So money does matter, and there's no point pretending otherwise in terms of improving care, widening access, recruiting and retaining staff. If you look at the current pledges in the Labour manifesto, very little of it has earmarked funding. They're putting £2 billion into 40,000 extra operations and investigations and appointments a week to try and get waiting lists down. They're putting more money into 8,500 mental health workers to improve mental health services, and more money into children's dental services. But none of the other broad brush ambitions have any earmarked funding attached at the moment. And what they're saying on the record is that as the economy grows, they may be able to put more money in. But I think they're a bit constrained by the commitment not to increase taxation.
So that leaves us then with a difficult situation where real terms funding may not increase, at least in the short term. So what can be done culturally to change the NHS and make it more productive?
Well, I think one thing is when we talk about NHS funding, we have to think as well about funding prevention and inequalities and the wider determinants of ill health, because population health is a big driver of demand and most of people's outcomes aren't to do with healthcare. So we've got to have health in all public policy to tackle things around, say, food, alcohol, drug addiction, housing and so forth, and put the money into public health that was taken out. And we need to solve the social care funding and provision crisis. Now, that's not NHS money per se, but it will benefit the NHS. And then the other thing is within the NHS, within the money we spend, we keep raiding the capital budgets that pay for buildings and scanners and information technology to prop the service up. And it's a false economy. We do need decent facilities, decent equipment, decent buildings, decent IT. And within the money the NHS spends, everybody knows, but it's not been achieved yet, we need to put more of the money into primary care, community care, care outside hospital prevention, so that we're not constantly responding to crises and treating people in hospital that could be treated out of hospital. And most of all, we've got to invest in the workforce. The clinical service that's provided by the NHS is delivered by doctors, nurses, allied health professionals that the public deal with every day. And currently the workforce has a morale and retention crisis. And yes, some of it's about improving terms and conditions and ending the junior doctors' strike and so forth. But it's also about treating people better, looking after our people so they want to remain in the service and carry on providing services for the public.
But one obvious solution to the junior doctors' dispute, for example, is more money. As we've discussed, there isn't more money, or certainly not much more money.
Well, of course, settling the junior doctors dispute would probably cost less money than all the cancellations and aggravation that's happened on the back of it. And of course, they have settled in Wales and they've settled in Scotland, and not for 35% one-off payment either.